drug information tools. The drug information tools in this video are different because they're meant for professionals. So the information you find in these tools will be much different than you would find by doing just a basic internet search or something you would find on a site like WebMD. It's in-depth information. The tools I'll be talking about are Access Pharmacy, Clinical Pharmacology, Lexicon, Micromedics, and the Sanford Guide. I'll be talking about what's different among each tool, like tools that they have and the way the pages are organized, and I'll also be highlighting what is the same among them. So the same standard information that they all have, and I'll be using things like the Beers criteria and pregnancy and lactation information to serve as kind of a guide for how things are organized differently across these different platforms. I have a navigation tip before I begin demonstrating these tools. The first tip is to not use Google to try and get to these tools. Don't just do an internet search and go to the site. Use a UTEP link to the tool to ensure you get access to UTEP subscription. The first drug information tool I would like to talk about is called Access Pharmacy. You can find Access Pharmacy from the UTEP Library's Pharmacy Research Guide on the Databases tab. You can scroll down to the box that says Pharmacy Databases. They're all in alphabetical order, and you'll see that Access Pharmacy is the second one. Access Pharmacy is McGraw-Hill's database of specialized content for pharmacy students. It has drug information, but it's not the primary focus. Across the top of the screen, you'll find different sections. One of the main focuses are the textbooks and reference books that you can find here. You have full text access to them. The other nice thing in Access Pharmacy are the study tools. These are some of the study tools that you have access to in Access Pharmacy. If you want to use the study tools or mark your place in the case studies or save your favorite content, you need to create an account in Access Pharmacy, and you can do it using the sign-in link at the upper right corner of the screen. Create your account there. To find drug information, the most direct way is to click Drugs from the home screen. So we'll go ahead and click Drugs, and then we can search the drug monographs here. I'm going to do a search for tramadol. And if there are variations, we'll get them here. I'm going to select this one, and we'll be taken to the drug monograph for tramadol. So at the top of the screen in Access Pharmacy, you'll find the monograph's table of contents. There's a section specifically for pregnancy and lactation information. You can jump straight to it. But if you're looking for the Beers criteria, you have to scroll down a little bit. It's nestled here underneath the medication safety issues section. The next database I'd like to show you is Clinical Pharmacology. I am still on the databases page of the Pharmacy Research Guide. Clinical Pharmacology is also in this list. It's a drug information tool from Elsevier that was made with pharmacists in mind. It boasts 24/7 live updates to drug information. Some of the things that make it unique are the way that it's organized. It has a lot of resources. I'm highlighting them on the screen right here, such as patient education, clinical calculators, drug class overviews, and things like that. It also has lists of drugs based on specific topics, which you can access from the main page. And there are also reports that are coming out on drug interactions and IV compatibility, and those are updated regularly. So let's do a search for tramadol in clinical pharmacology. So in the results, it gives us a few different sections. There are the regular drug monographs. It gives us different US product names, and it also gives you a list of global drugs in case you need to look those up. I'm going to look up the regular drug monograph for tramadol. And there's a lot going on here. Let me draw your attention first to the table of contents at the left side of the screen. So this is how you can navigate to different sections if you need to. Or you can just scroll through all of the content in the middle of the screen. The Beers criteria is located at the top of the screen, and you can see it is detailed. There's a lot of that to scroll through. If you're looking for the pregnancy and lactation information, you can just use the table of contents. and there's a section for it here. The next drug information tool I want to highlight is called Lexicon. It is also in this list of databases. A little bit further down, I'm clicking on Lexicon now. Lexicon is a drug information tool from Wolters Kluwer, and it's made for clinicians of all kinds. So you'll note that there are a lot of tools you can navigate to the top at the top of the screen in Lexicon, like patient education, the calculators, and there are other clinical tools underneath that menu as well. In Lexicon, let's do a search again for tramadol. It's giving me suggestions. I'm going to go ahead and click search everything because here we can see what's unique about Lexicon. And that is that when you see results, you're seeing entries from different Lexicon databases. So Lexicon has a lot of different resources inside of it, and you can see the names of some of them on the screen right now. LexiDrugs, pediatric and neonatal LexiDrugs, for example. If you're looking for general overall drug monographs, you'll want to choose the entries underneath LexiDrugs. I'm going to choose the general drug monograph for tramadol. And you can see from in here, there's a link to adult patient education if you need to provide that. On the left side of the screen, we can see our table of contents, or we can just scroll through everything in the middle of the screen. If we scroll down, we can see reproduction, pregnancy, and lactation information. So if we're looking for Beers criteria, we need to look up here to medication safety issues. And it's here underneath geriatric patients, Beers criteria information highlighted on the screen. The next tool we'll be talking about is called Micromedics. It is also in this list of databases in alphabetical order. It's Micromedics Solutions. When you're navigating to Micromedics Solutions, you will always see the screen. Make sure to choose Micromedics. A little bit about Micromedics. It provides summary and in-depth drug information from IBM for healthcare professionals of all kinds. There are specialized tools along the top that I've highlighted on the screen, and you can find drug calculators underneath other tools. You can also use natural language to ask Watson the supercomputer questions about drug information, and you can find drug information tools underneath the resources category. I'm not going to ask Watson the supercomputer a question today. I'm just going to do a search for tramadol. And it took me straight to the drug monograph for tramadol. So we have our table of contents on the right side of this, on the left side of the screen, and we can use this to navigate to different sections. I'm going to pregnancy and lactation. So notice that we're underneath quick answers. So for medication safety for pregnancy and lactation, very short and sweet amount of information. If you need more detail, you can switch to the in-depth answers tab. You'll stay in the same category, and you'll see it is much longer, more detailed with citations. If you're looking for the Beers criteria, you'll need to look underneath precautions underneath medication safety. And here is the Beers criteria information for tramadol. I also want to note that if you look to the right side of the screen, you'll be directed to consumer drug information about tramadol, and you can even look this up in the Red Book. The last drug information tool I want to show you how to navigate to is the Sanford Guide. It is also in this list of databases. We can scroll down to Sanford Guide. This is Sanford Guide. Sanford Guide is a resource for clinicians with information on infectious diseases and substances to treat or prevent them. You'll find information in tools near the top of the screen, and it really is an incredible amount of information, not just about drugs, but if you use the menus on the top of the screen, it's information about the conditions, the diseases, and the infections that are being focused on in this database for treatment. You also have infectious disease news near the bottom. And if we wanted to do a search, tramadol wouldn't work in Sanford Guide because it's not used to treat infectious diseases. We'd have to pick another drug. So I'm going to do a search for remdesivir. From the results, you'll see a lot of different things with remdesivir in it. If you're looking for the drug monograph, you'll want to look for an entry with just the name of the drug in it. You can see the table of contents on the right side of the screen with dosing information and adverse effect information, etc. If you want information on pregnancy and lactation, this is the extent of what you'll usually find in Sanford Guide, just on usage. So that was a very quick overview of the drug information tools you have access to at UTEP. I'd like to do a quick recap before we finish. We talked about Access Pharmacy, Clinical Pharmacology, Lexicon, Micromedics, and Sanford Guide. Notice that the audience for Lexicon, Micromedics, and Sanford Guide was primarily for clinicians, while Clinical Pharmacology was made with pharmacists in mind. Access Pharmacy is made for students. Let's think about the content. Clinical Pharmacology, Lexicon, and Micromedics have primarily drug information. Sanford Guide has drug information as it relates to the treatment of infectious diseases. Access Pharmacy has drug information but also focuses on study tools. Try them all. Explore the tools inside and find your favorites. You have access to all of them as students, and as professionals, you'll have to narrow your taste. So explore them now. I hope this overview helped. If you have any more questions, please email me. My name is Angela, and my email address is on the screen, or my colleague Harvey. There's also an address where you can send your questions. If you have general questions about using the library, please call, text, or ask us using the contact information on the screen. Thanks for watching.